One of my patients walked into my office with a phrase I will never forget. "Doctor, I wake up 5 times every night to urinate, and I don't believe in healing anymore." What happened next changed not only his life but how I approach natural prostate treatment. This is a story that challenges everything you think you know about men's health. Most doctors immediately prescribe medications or suggest invasive procedures for prostate issues. But what if I told you there was a different path, one that costs nothing and takes just minutes? My patient was skeptical too, having tried multiple treatments with little success. He was desperate for a solution that would give him his nights back. I am Dr. Isabel Lopez, a specialist in men's health with over 15 years of experience. I have helped thousands of men reclaim their quality of life through natural approaches. Tell me, where are you watching from today? Drop your city in the comments below. And please, follow this channel because what I am about to share could change everything. This patient's journey started with doubt, but ended with complete transformation. The method I taught him required no pills, no surgery, and no expensive equipment. Just 5 minutes of targeted movements that awakened his body's natural healing power. But first, let me tell you about the moment everything shifted for him. Day 1 of treatment, he looked at me like I had lost my mind. "Doctor, you want me to do yoga? I can barely touch my toes." I explained that this was not about flexibility but about activating specific nerve pathways. The first movement targets the pelvic floor muscles that directly affect prostate function. I taught him a simple pelvic tilt exercise that takes 30 seconds to perform. The key was breathing slowly while gently engaging the deep core muscles. Most men rush through this movement, but the magic happens in the slow, controlled motion. When done correctly, it increases blood flow to the prostate and reduces inflammation. His biggest mistake in the first week was holding his breath during the exercise. I had to remind him that breathing is what carries oxygen to the healing tissues. The nervous system only relaxes when we breathe deeply and intentionally. This is why many men see no results. They focus on the movement but forget the breath. By day 3, something remarkable started happening in his body. The constant pressure he felt in his pelvis began to ease slightly. His sleep improved from waking 5 times to just 3 times per night. These small changes gave him hope that bigger transformations were coming. After 7 days of consistent practice, he called me with excitement in his voice. "Doctor, for the first time in months, I slept through the night without getting up." This was our first major breakthrough, and I knew we were on the right track. His body was beginning to respond to the gentle stimulation of the pelvic nerves. The improvement in his urinary flow was noticeable but not dramatic yet. However, the reduction in pelvic pain was significant enough to boost his confidence. He reported feeling more energetic in the mornings instead of exhausted from broken sleep. Stick with me until the end because the next movement created an even bigger shift. What many people do not realize is that prostate health is connected to overall circulation. When we improve blood flow to the pelvic region, multiple systems start functioning better. His digestion improved, his mood lifted, and his energy levels stabilized throughout the day. These were signs that his body was entering a healing state naturally. The first week proved that simple, consistent action could create measurable change. But I knew we needed to add another element to address the deeper muscle patterns. The next movement would target the root cause of his prostate enlargement. This is where the real transformation would begin to take hold. I introduced him to what I call the bridge pose, a modified version for prostate health. This exercise reactivates circulation in the prostate while strengthening the pelvic floor. Unlike regular bridge poses, this version focuses on precise muscle engagement patterns. The goal is to create space and reduce pressure around the prostate gland. The technique involves lying on his back with knees bent and feet flat on the floor. As he lifts his hips, he breathes deeply and imagines energy flowing to his pelvis. The key is holding the position for 20 seconds while maintaining steady breathing. This was when he first said, "I can feel the pressure starting to dissipate." His common mistake was trying to lift too high and tensing his entire body. I taught him that gentle elevation with focused breathing was more effective. The bridge pose works by decompressing the pelvic organs and improving lymphatic drainage. When performed correctly, it creates lasting changes in prostate tissue health. Within days of adding this movement, his symptoms improved dramatically. The urgency he felt when needing to urinate began to fade significantly. His stream became stronger, and the feeling of incomplete emptying disappeared. This was proof that his prostate was responding to the increased blood flow in space. Before we dive deeper, I want to share something special with you. I have created a 21-day challenge designed to help reduce and prevent prostate enlargement. These are simple exercises you can do in less than 15 minutes a day. Do not wait. Grab your copy of the ebook right now. The link is pinned at the very top of the comments. Research shows that increased blood flow and pelvic muscle relaxation reduce prostate size naturally. Studies demonstrate that targeted movement therapy can decrease BPH symptoms by up to 60%. The parasympathetic nervous system, when activated, allows the body to enter repair mode. This is why stress reduction and gentle movement are so powerful for prostate healing. My patient's body was no longer in constant fight-or-flight mode from chronic discomfort. When the nervous system relaxes, inflammation decreases and healing accelerates naturally. The prostate gland, like all organs, responds positively to improved circulation and reduced tension. This scientific understanding validates what ancient healing practices have known for centuries. The beauty of this approach is that it addresses root causes, not just symptoms. Medications might temporarily reduce symptoms but do not heal the underlying tissue dysfunction. Natural movement therapy restores proper function, while strengthening the entire pelvic region. This creates lasting results that continue to improve over time with consistent practice. The final piece of his healing puzzle involved what I call breathing downward. This technique activates the pudendal nerve, which directly controls prostate function. Most men breathe into their chest, but this method directs breath into the pelvic floor. It sounds simple, but the results are profound when practiced consistently. I taught him to place one hand on his chest and one on his lower belly. The goal was to breathe so that only the lower hand moved while the chest stayed still. As he breathed down, he visualized the breath flowing directly to his prostate. "It feels like something inside me is finally able to relax," he told me. This breathing technique works by stimulating the vagus nerve and promoting deep relaxation. When the pelvic floor muscles release tension, pressure on the prostate decreases immediately. The pudendal nerve, once activated properly, helps regulate prostate size and function. Within 2 weeks, his follow-up exam showed measurable reduction in prostate volume. The combination of all three movements created a synergistic healing effect. His body had learned to maintain proper pelvic alignment and circulation throughout the day. Even when he was not actively exercising, his improved breathing patterns supported healing. This is when he truly understood that his body had always possessed the ability to heal itself. Join the Members Club and drop a super like if this story has given you hope. In 30 days, that patient who had given up on healing was living completely normally. His nighttime bathroom visits went from 5 times to maybe once, if at all. The chronic pelvic pain that had plagued him for years was completely gone. Today, he teaches other men this same 5-minute protocol that transformed his life. He has become an advocate for natural healing and helps men avoid unnecessary procedures. "The solution was in my own body all along. I just needed to activate it," he says. His confidence returned, his relationships improved, and his quality of life soared. What makes this approach so powerful is its simplicity and accessibility. No expensive treatments, no side effects, no dependence on medications or doctors. Just 3 gentle movements performed consistently for 5 minutes each day. The human body is designed to heal when given the right conditions and support. Men over 50, you can start today with these same techniques that changed his life. 5 minutes per day can restore your freedom and give you back your nights. Your prostate has been waiting for you to provide the movement and circulation it needs. The question is not whether this will work, but whether you will commit to your own healing.